Art therapy is a form of psychotherapy in which trained and credentialed art therapists invite different types of populations who have perhaps been traumatized or are going through some kind of medical or mental health issue. We allow for them to express using the art making process. They have a hard time verbalizing what they've been through, not only due to stigma associated with, or secrecy, if you're in a special unit in the military, also because of a verbal shutdown that occurs in a traumatized individual in the speech language area of the brain. They are intimidated at first, and sometimes they look at you like, what are you asking me to do? But once they get into the process and they start exploring the materials, oftentimes all of that melts away. When they're trained in the military, they're trained to be very focused in those moments when they're on missions, when they're shooting a gun. You get into this flow state, and I think what they're finding is when they are engaging in the art making, they're in a similar type of flow state. They're also self-reflecting, and so that helps them overcome that intimidation. We've seen a lot of work surrounding identity, and so that's where the masks come in.
So Melissa, I'm excited to hear about your therapy, the mask therapy, and how that works. Can you enlighten me?
Sure. So one common directive that many art therapists use across different treatment populations is mask making. And so I think that a blank canvas or a blank sheet of paper might be a little too intimidating, and there's something about the way that this encompasses the invisible moves of war, envelops the brain, that allows for them to really start to self-reflect and then begin to speak with the art therapist about it.
So it's a catalyst for getting these feelings out and expressing themselves through a three-dimensional piece of art. So I see some parallels between the project that I've done and what you're doing. The helicopter became such a touchstone for these veterans or active service members that in the sense that it releases emotions, it's a catalyst for conversation. It gets veterans out of their own skin in a sense.
Yes, it's very similar with the masks. I think that they're tactile, and researchers know that the trauma is sensory. It's sight and it's sound and it's smell, and it's the feeling of that moment. And as they approached the Huey, they did begin to share experiences both with you and with each other. And that similar kind of tactile experience occurs when a service member or a veteran is engaging in art therapy. While I was in school, I was studying trauma, and when we were studying post-traumatic stress, I realized that I had been around my grandfather my whole life and had observed the impact that war had on his psyche, and then decided that I'd like to work with the military population. Unfortunately, I never got to introduce this to him, but now I'm hopefully impacting others like him.